Welcome to another episode of Got Time with Christopher John, your scholar and gentleman in a hoodie. James McCune Smith, the first African American to earn a medical degree, was educated at the University of Glasgow in the 1830s, when no American university would admit him. Smith was also one of the nation's leading abolitionists. In 1859, Frederick Douglass declared, "No man in this country more thoroughly understands the whole struggle between freedom and slavery than does Dr. Smith, and his heart is as broad as his understanding." A prolific writer, Smith was not only the first African American to publish peer-reviewed articles in medical journals, he also wrote essays and gave lectures refuting pseudoscientific claims of black inferiority and forecast the transformational impact African Americans would destined to make on world culture. Smith was born enslaved in New York City in 1813, and yes, slavery was in New York too. He received his primary education at the African Free School in Lower Manhattan, an institution founded in 1787. The aim of the school was to prepare free and enslaved blacks to become good and useful citizens of the state once full emancipation was granted. Even among his exceptional classmates, Smith stood out as a school's star pupil. Freed by New York's Emancipation Act of 1827, Smith graduated with honors at the age of 15. He was served as an apprentice to a blacksmith while continuing his studies with area ministers. He faced discrimination when applying to colleges in the U.S. He eventually enrolled at the University of Glasgow in Scotland, where he graduated with a bachelor's degree in 1835. He went on to earn a medical degree from the University of Glasgow in 1837, becoming the first African American to do so. As the first African American to earn a medical degree, Smith faced significant discrimination in his medical career. Despite this, he was determined to make a difference and become a leading physician in New York City. In addition to his medical practice, Smith also worked to break down barriers in the medical field. He became the first black pharmacist in the United States and the first African American to run a pharmacy. He used his position to advocate for the health of black Americans and to call for the end to discriminatory medical practices. Joining me at the table is the Director of Strategic Community Engagement with the Cincinnati Cancer Advisors. She is a former meteorologist, but most importantly, a cancer survivor turned advocate who played an essential role in the passage of Ohio House Bill 371, a law that aims to help more patients get the screenings they need to detect cancer more quickly. Sherry Hughes, thank you so much for taking the time to join me here today.
Thank you, Chris. It's my pleasure to be here with you.
Well, I'm glad you have taken the time to join me. I know we've had several conversations, and you have been doing some wonderful, wonderful work. But before we get into the conversation, can we unpack your journey a little bit into the work that you're currently doing now?
Yeah, well, thank you. Wow, the journey, when you say unpack it, that's a lot because the journey is still ongoing, but my progress is good. My prognosis in terms of breast cancer, I'm cancer free. So
Amen.
Thank you, God. Amen. Yeah, to that. But it is a journey. Mm-hmm. Of course, with every journey, it starts somewhere. And my journey began with many, many, many years ago with my mom being diagnosed with breast cancer when I was young. And losing my mother within a year's period of time to a disease that we really had very little knowledge about because we didn't know that what cancer was really, and we weren't in contact with many people that we knew of were diagnosed with a cancer or even survivors, because back, when I was growing up in the 80s, 90s, or what have you, people just weren't talking about it very
Right.
much.
So you said she was diagnosed and she passed away a year later after the diagnosis?
Yeah, and my mom, I always speak her name. Her name is Lily. I believe now that I look back through the years on her journey and how it impacted my journey, I believe that my mom literally was pretty much dealing with some healthcare disparities, because there was so much that we didn't know, so many things we couldn't ask. Advocacy was very limited, and even in our own perspective, because you don't ask about what you don't really know about.
Right.
But yeah, because of mom, though, I really started leaning into learning more about cancer, about breast cancer, about what I could do to be a voice, what I could do to maybe help someone else. And I thought it was, relegated to giving some money, some financial support,
Right.
doing a few walks here or there, or attending some events. But little did I know that really planted a seed deep within me to start advocating. And I tell people all the time that sounds like that's just a mighty big word, and wow, that means a lot of things. But in all actuality, Chris, you and I both know, it just means having some conversations. It means knowing how to ask questions, and also how to hold people accountable. And so, of course, many, many years later, I was diagnosed with the same disease, breast cancer. But because of genetic testing and all of that I had underwent, from what I know, my cancer had no relation to my mother's cancer. 1 in 8 women will be diagnosed with a breast cancer in her lifetime. That's just a breast cancer, 1 in 8. So I'm one of the true 1 in 8. Happens to be that my mother had that disease as well, but genetically, there's nothing genetics based that's tying our diseases. Also, in the realm of everybody's life, 1 in 2 men, 1 in 3 women. So that's just about half of the population for male and female that will be diagnosed with a cancer in their lifetime. So if you live long enough, it means that, you may be looking at a cancer diagnosis. And I say that because unless there's some radical discovery tomorrow that says if you're diagnosed with something, we can cure it right away. And for some diseases and cancers, that could very well be the case. But there are so many different kinds of cancers that it's not a one size, Chris, fit all.
Right.
So while they're making great, advances in breast cancer, prostate, lung, and all these other cancers, there are many, many more cancers.
Right.
So yeah, I am, I'm advocating now for those that have not yet found their voices, and we want to encourage them to find their voices. I work with Cincinnati Cancer Advisors, and the work that we're doing, I think, is just phenomenal.
I would like to say, we talk about advocating for our health. And I shared with you before we got on that I was a part of a webinar, and it talked about advocacy, about us being our primary stewards of our own health. And so can you share, that process, especially for those who may not think this is going to touch them, because you provided the numbers. More than likely, if it's not you, it's someone in your families that's going to be impacted by cancer. I'm not alone in that. My mother, as I shared, had multiple myeloma, which is a blood cancer. But can you provide or share your experience of how you advocated for yourself? Because sometimes we feel that, we lean in, it's the doctor, they should know, whatever the case may be. But you took it a step further.
Well, knowing my mom's history, I stayed very vigilant, and I started, really paying attention to the information. You have to get information about cancers, about different testing methods and screening methods, and just learning about my body as well and what role I needed to play in this, paying attention to my breast health, my overall health. But it literally was because I was reading information and I saw that there were advanced tests that were out there that I wasn't getting. And when I turned 40, I knew that I had to have the mammogram, and I sought out the best mammogram, the Cadillac version, which is a 3D. It's the best mammography that is out there. And I was getting that annually every year like I was supposed to, and every year it always came back and everything looked good. But then I started reading up about some other things like high intensity ultrasounds and sonograms and the breast MRI, and it piqued my interest. And I asked my one of my doctors once, I said, why don't I get any of those other tests? You know, when you go to college, like both of us have been in college, you take every kind of test known to man, the ACT, the SAT, all the T's. You take everything because they measure different things. So I just, and I believe this is that very still voice, the voice of the creator that was really leading me to ask more questions. And that's a form of advocacy. So when I found out that, hey, yeah, these tests exist, however, insurance is a factor. Insurance likely won't cover this. Yeah. And if you have the means, you can get the tests, but you're going to pay, handsomely out of your pocket to get them. I'm talking like maybe $8,000 to $10,000 to $12,000 for a test. So knowing what I know about all the programs that are out there on the table, that oftentimes we as people don't know what's out there, but I knew enough to say, if I want to get this test, I'm sure I can get it. I can maybe qualify in some kind of program. I can get the test. So my OB-GYN at the time, she heard me. We had a good relationship, and I think that's important that people need to understand. You have to have a relationship with your care providers, your primary, whomever. That doesn't mean you have to go to dinner with them, every Sunday night or whatever, or go to each other's houses. But you need to build that personal relationship that allows you to really speak freely and ask questions and know that you'll be heard. So when I started asking, can I get this? And she was like, let's work on this together. Let's just see how we can get it. Wow. And that led to the cancer that was discovered at a very early stage. And, early detection saved lives. It improves in outcomes. It improves mortality. It literally is a lifesaver. So my cancer was found by the grace of God and my own self-advocacy and having a relationship with my doctor so I could ask the questions and get the answers that I needed to start me on the road to wellness.
Wow.
To wellness, because I didn't know at the time that I was not well. Nothing about my cancer was ordinary, so to speak. Number one, I could not feel anything. I had no symptoms. I had no lumps. I had nothing. As far as I was concerned,
you were healthy.
I was healthy. I was just, going down the path of discovery, meaning, hey, let me get this test, and I'm using it as maybe another, baseline type of testing to say, in the event that anything else were to come up later in life, hey, we've already started a path forward. And lo and behold, the path that test, when I received it, again, hard to get, but got it, showed a very small invasive ductal carcinoma, a breast cancer.
Wow. I mean, just your testimony, it speaks volumes to me personally. And I'm quite sure to the viewers and listeners as well, because you think that, I feel great, I feel fine. Or you might just chalk something up, well, I'm just getting older, and those things you do have to check out. You got to advocate for yourself. And I like when you talk about having that relationship with your physician and your caretakers.
One of the things I did want to mention too, because I talked about getting the 3D mammogram, which was the best type of mammography in the world. However, it could not see my cancer. The thing I was getting every year could not see my cancer. In fact, when the breast MRI detected it and saw something very small, I was then sent back to the 3D mammography to try to get a three-dimensional look of it, but it couldn't see it.
So the Cadillac couldn't do it, so you had to go get a Maybach.
I had to go get a, that's right. I had to go Maserati, get a Bentley. But I think what we're really saying is I do believe that the 3D is still the best mammography, but the 3D does not see every cancer. So why are we relying on one method of testing for people when we know that, one method may not do it? And 3D is an advanced screening, but so is the breast MRI. But the breast MRI is just, I think eons in many respects, eons above, because it can see so much even when it's very insignificant.
Right. And so because of your efforts and others, this House bill in Ohio that has allowed it to be feasible and available for these other screenings to take place, so you're not just regulated to the Cadillac.
Yeah, that's true.
That you can that if you need to use the Bentley or the Maybach or whatever the case may be, that you can do that. And so I just want to make sure that there's an understanding that because of your advocacy, not only for yourself but for others, there are more screening opportunities.
Yeah, and Chris, thank you. I like to think in terms that I was, I played a small role.
Well, it wasn't small.
In using my voice. I want to give a shout out to Michelle Young, who's an attorney in town, who literally, the bill was somewhat crafted after her own diagnosis with stage 4 breast cancer. Lots of different clinicians from across the state were pulled in. Other survivors were pulled in, but we had bipartisan bill that was created by Representative Schmidt and Denson at the time. Across party lines, imagine that.
And what year was this?
Yeah, that was 2022. I mean, 2021.
Not that long ago.
The bill
2022.
was, and so this just goes to show you that, people from across the aisles, we don't want to get political, but we can bring people from across the aisles together to work on life-saving, legislature.
Well, this is the thing. And we're going through it right now with what's going on with the administration. Healthcare and caring for human beings should not be a political. It's about humanity.
Yeah, it is.
And so that's what's disheartening.
Yeah, but everything has a price, and the way that we go about covering the price sometimes becomes quite political because, when you look at the social determinants of health, the things that keep us away from good health, one of those big things are policies and laws, are economics, are your zip code where you live, are things like your education or your access to education. So it shouldn't be in a perfect world, Chris. It wouldn't be. In a perfect world, it would not be. But the world that we live in is quite flawed, but it's still a beautiful place. And we are advocating and helping, trying to walk this walk with healthcare and advocating for ourselves and for others because we get that, like you said, it's about humanity and we get it. And nothing is cut and dry anymore. Everything is such a process that you go through. So I was a proponent speaker. I was just one of many. But we all came together and we lifted our collective voices together to get that bill passed in Ohio. And that's for Ohio women and men. Anyone that has dense breasts, a woman, of course, men get breast cancer as well. Anyone that has a family history, anyone has any other well-documented breast issues or whatnot. Now in the state of Ohio, it means that you have access, because of House Bill 371, to even higher advanced screenings. Again, 3D is an advanced screening, but if you have the criteria that we just talked about, you may need more than just a basic 3D mammogram with tomosynthesis. You may need an ultrasound guided, which is another aspect, or maybe it's some type of sonogram, or the breast MRI, you may need one of those things to help see what one technology isn't able to see. And that saved my life because it found the cancer in its infancy. But even in its infancy, it was still small and aggressive, smaller than a grain of rice, still very aggressive. And had it not been found when it was found, because of the aggressive nature of it, I might not be sitting here with you today.
Wow. Wow. Now, you said something I just thought about. You talked about men.
Let's talk about men.
Yeah, let's talk about men. So, there's prostate cancer, but you also talked about men that breast cancer, because I think Richard Roundtree, the actor, I think he was diagnosed with breast cancer and got it treated. So I was curious, and you may not have this answer. So is it the same type of screening if for men in this same region of your body, or is it something different?
For men, because men don't have a cup, they have, the breast walls or what have you. You can get ultrasounds, if you detect a lump or find something that's abnormal on your chest area, then you can go in and, of course, they can do maybe your ultrasounds or sonograms or whatnot. You may even be able to be utilized with the breast MRI in some kind of capacity, because it just really, anything that can get an image, and maybe it is the 3D, it will depend upon what your doctor thinks is needed, because maybe they're able to get a biopsy for a man almost immediately, a little bit easier. Men don't typically go and get an annual screening for breast cancer, but what men need to know is, do you have a family history? If you have a family history and your mother had breast cancer, maybe even your grandmother or a sister, then you need to start asking yourself, what are the possibilities that I may have a male breast cancer or could have one? And you and I talked on the phone recently, and there is a correlation between breast cancer and prostate cancer.
Wow. Yes.
Because of what we call the BRCA1 and 2 gene. Women and men both have it because it is an inherent gene that comes from both parents. However, what you need to understand, do you have the mutation? Because if that gene mutates, then literally you will understand that you are at a higher risk for breast cancer or prostate cancer, or maybe even other cancers. So, I have a brother and I have a sister, and while I know that I've been tested genetically and I don't carry any kind of gene, I didn't get a gene from either parent, I can't tell you that the same for my sister or my brother, my siblings. Each person has to be tested on their own. So let's have this conversation about genetic testing. These days, you can do it now with a blood draw. You can start that process with a blood draw. So you go into your doctor for your primary care and you're going for an annual physical. That's the time to have the conversations. That's the time they usually know your family history. They ask you to fill out a questionnaire. Does your parent, a mother or father have any kind of cancers or whatever? And so you can take it further because they're looking at this, your information there, and they may read through it really quickly, but it's incumbent upon the individual to say, look, my mother had breast cancer, my sister had breast cancer. What does that mean for me? That doctor should be able to then say, you know what, I don't know. Maybe we should now do genetic testing to see, if you have any type of genetic connection, maybe a gene or so that you got from your mother, or your father, or your grandparent, what have you. So that's very important. That's one thing our people, anyone, but especially people in our culture, because we talked about this earlier. African Americans have the highest mortality rate and the highest rate, when it comes to just about almost most of the cancers.
Yes. So earlier today, I was fortunate to my fraternity, Alpha Phi Alpha Fraternity Incorporated, had a health webinar about blood cancers. And you talk about this, knowing your family medical history.
Yeah.
On this podcast, on this platform, we talk about Black history, we talk about our history, but our medical history, especially as it relates to our families, is very important. And so my mother had multiple myeloma, which is a form of a blood cancer. And so I wanted to know more information, and they provided a great deal of information. And I remember when my mom was diagnosed, that would have been in 2009. That was the first time I've heard of it. And today in the webinar, 20% of the multiple myeloma cases are African American. And
That's right.
And so
We're not talking about it.
no, we're not.
We're talking cultural now. We're talking the African diaspora. We're talking Black folk. Of course, everybody needs to know their family history, and everybody, no matter who you are, needs to understand that you're not going to live forever, and you need to know your body, and you need to know your health, and all those constructs. But more for the African American, for the Black person, it's imperative, because we have so many. We have so many social determinants of health that are not working in our favor. That we have to be more vigilant. We have to be more aware, and we really, Chris, have to start having these conversations in our families. It took you to know that your mother had multiple myeloma before you kind of dug in a little deeper to it. Sometimes that's what it's going to take. It took me.
You know what? You can't even give me that amount of credit, because even when she was diagnosed with it, I'm going to be real and honest. I really did not even think about it for myself or my family until I became a caregiver for her. And this was many years, because she was managing it just well. I mean, she had, and we talk about clinical trials. The medicine that she was given was actually something that was very new. Now I look back on it now, I was like, I think she was actually part of a clinical trial, because it was a new medicine, which is now it's.
Yeah, but she's helped with the research of it so that other people now can get it and may be able to survive longer or live longer.
Absolutely.
Because that's another thing we need to talk about with our Black population of people. Oftentimes we don't know anything about the trials. Oftentimes we don't get into studies.
But it's the stigma too. I think
it is a stigma. We know. We talked about earlier on, like the Tuskegee, some of these precursor things that happen. The Henrietta Lack, with the HeLa cells. That was yesterday, and that's important because we can never forget it. But we've got to rise above being afraid and always feel like somebody's trying to do something to us, and we have to then try to do something for us.
Yes.
For us. And that's what I feel like I've been doing with my voice, and I still feel like I haven't scratched the surface. I can do so much more, and that's now what you're doing with your voice. But we need to start saying, listen, there are guardrails. If you're afraid of something, then you know what? There are guardrails for these things. You can make sure that you're going to, the doctor that you choose to go to. You can make sure that you are, researching the research for yourself and bringing other people in it. Everybody's not trying to kill us. Right. I mean, this is serious business now with our health. And it's not just about cancer, it's about every aspect of our health. We got to work for us.
Absolutely. I would say, more more than ever, we can't be lazy when it comes to our healthcare. I've had the hardest time, and I've shared this with you, the most difficult time of finding me a primary. There's a shortage.
Isn't that something?
It's the reality. There's a shortage. Even in the seminar I saw this morning, they said it was a shortage in nutritionists. When you're dealing with, when you have a cancer, having a oncology nutritionist, there's a shortage with that. But there's also a shortage of doctors and primaries.
Doctors and African-American doctors, if that's what you're looking for. Because sometimes we feel like, oftentimes that's what we may be looking for, because we feel like that's a safer place to be.
It's that relationship part.
That relationship is maybe a safer place for us, because when we start worrying so much about, the things that have happened in the past, sometimes we feel maybe a little bit more comfortable. It doesn't matter who you choose. You get the right to choose what doctor you go to. But if there is a shortage and there are not, as many doctors of color and black doctors or whatever, and that's where your comfort zone is, then yeah, we are looking at, some significant holes, to our health. We're not getting what we need. I want to just throw this shameless plug in for Cincinnati Cancer Advisors. Of course, when you come to Cincinnati Cancer Advisors, you're already diagnosed with a cancer. But we're there independently to provide free second opinions, genetic testing and counseling and patient referrals, and no insurance is involved at all because we understand the financial toxicities. But we also are there for those referrals for doctors, for if you're, you get this diagnosis to help you know where the trials are, to maybe kind of introduce you to some of the studies that may be available in this area. So information is out there. We've got to learn how to tap into the information. Even for a place like Cincinnati Cancer Advisors, if you're looking for a doctor in a certain specific field or whatever, maybe you look into these organizations that may be able to give you referrals to where you can go.
I will say, and just to be clear, all that the services, the information, all that is completely free.
Yes, it's completely free. We always say it's free to our patients, but it's not free to our society because it is our generous donors, people that believe in the work that we do, people that come to our events that are actually paying it forward. And because they understand that not everybody can afford health care, and not everyone can afford quality health care. It's about the quality. It's about having the access and feeling very comfortable, when you have that access. Because we talked about some of the fears that are really are there. But I want to tell people, you can fear a lot of things, but don't let fear keep you from getting treatment, help, seeing a doctor. Don't let fear keep you from getting screenings because you don't want to know if you have a cancer. Don't let fear of your parents' cancer or your siblings' cancer keep you from acting, because my mother's cancer is not and never was my cancer. But my mother's cancer opened my eyes to the fact that it was even possible. And I'm living a different, I'm living a different scenario from my mother.
Right.
If my mom had had half of the things that I had, I believe she would have still been alive. But during the time of my mother's cancer, a lot of the things that I had not even been created yet because it's research. People paying it forward and getting in these studies and trials.
That made me think of, I saw an interview with Killer Mike, who is a phenomenal artist, and despite the name, if you don't know, is a phenomenal artist but brilliant mind. And he comes out of Atlanta, Georgia, and he said his father would say, his grandfather would always say, the world is going to learn you. The world is going to learn you. And so you're talking about your mother's passing. You learned a lesson from that you're carrying, and so you're basically advocating out of her spirit, which is beautiful.
Oh, see, you just said it. I often tell people, I know we say this all the time, that my mother, that we say things like, she lost her battle, he lost his battle. And I get that where we're saying that, where that comes from, but I always like to look at it like this. My mother never lost a battle. She passed on the baton. Yep. So that now, you know what, you have it, run with it, and that's why I speak her name in the conversations that I have, because she didn't lose. Disease is rampant across the land. If it's not cancer, it's diabetes, it's kidney failure, it's heart failure, it's rampant, and we fight, and we continue to fight it. But sometimes, our bodies aren't able to literally defeat it,
Right.
but things are getting better, especially on the cancer front. I mean, there's just so many new advances in cancer all across the board. But we have to be a willing participant in our own health. We got to get those screenings. We got to have these conversations in our families and in our communities, and we got to help others that may not know how to advocate, how to ask questions, where to go and what to do. We've got to be there to stand in the gap.
So let me ask you this. So Cincinnati Cancer Advisors. So that's here in Cincinnati. So I have listeners and viewers that are here in Cincinnati. That's a resource for them. Is this part of a national agency, or this is strictly for Cincinnati? And if that is the case, are you aware of there are similar agencies in other major cities possibly?
First of all, Cincinnati Cancer Advisors, we're powered by the Cincinnati Cancer Foundation. Our founder is Dr. William Barrett. And I'd love to say we were a national entity, not now, but I'm sure someday. But our doctors, we have our oncologists and our clinical team, their licensure is in Ohio, in Kentucky, some Indiana. We may have a particular doctor or two that may have another license in maybe Maryland, and we have licensure in Florida. So right now, we primarily see patients in the greater Cincinnati area, which really touches the tri-state. However, if there's someone in the whole state of Ohio willing to come down to Cincinnati to see us, because where people tend to go right now, they go to the James or they go to the Cleveland Clinic, and that's wonderful. That's great, but oftentimes, most cases, that's cost.
Yes.
That's a cost for you. However, our services are free, and we're independent, so we don't treat patients, but we partner with the patients, and we partner with the treating team. And what we do is we try to make sure that we're there to advocate for that patient, that they're getting the best plan of care, that we're going over their cases, and that we're discussing with them and giving them the confidence in their care plan by going through everything and making some recommendations if it's needed, or giving the assurance that what we've seen on your case from your treating team is on par with what we think we would have done, our doctors would have done. But it's collaborative. There's no competition in it. There's a lot of love in it, because it means that we want to be there to assist the team, the treating oncologists, and their, and the patient. We want to make sure that the patient is getting everything that they need to get the best outcome.
Right. I would say the only competition that I see is if you are listening or viewing this and you live in a major city and you have any power, influence, economic influence, every city should have this type of resource available. And I know it comes with resources. It comes with people who are willing to donate, but every city should have this. Absolutely.
Yeah, we've looked all over. Chris. And
y'all are trailblazers?
We are trailblazers. There are very few organizations like ours. There's one, I think, or two that we found in California and maybe the San Francisco Bay Area, but they utilize volunteer physicians that come back and forth to help with some of the consults. Our doctors are ours. They work for the foundation, and they work full time or part time in some respects, but they're not volunteers. They are working collaboratively together on the cases, and I think we have something uniquely very special.
You have the blueprint.
Yeah, we have the blueprint. Yeah. There you go. I love that.
You have the blueprint. I will say this, and I want to share this information, especially the webinar that I was glad that I was a part of. There is an organization called Blood Cancer United Nutrition.org, which it provides free services to protect and rebuild your body once you've had a diagnosis. And that is a national organization for that. And because that is a good segue of what I want to talk about is nutrition and healthy living. And if you can just share, you've gone through the battle of being diagnosed and now being cancer free, but also about nutrition and healthy living. And I've witnessed, and I know you walk, you take care of yourself. So can you talk about that side of it, about nutrition and healthy living?
I do, and I tell people oftentimes I was probably one of the healthiest people you would find, but I was still diagnosed with a cancer. At the time of my diagnoses, I was running 10 to 20 miles a week. I would swim 1 mile a week. I don't eat beef. I don't eat pork. Not that I have anything against those things, but I'm very heavily nutrition based in terms of eating healthy and clean foods. And some people would say, "And you got diagnosed with cancer?" I'm like, let that be some information to learn from. Anyone can be diagnosed with a cancer. Anyone. It doesn't matter how healthy you are. But I will say, Chris, the healthier you are, if you are diagnosed, your body has more than a fighting chance to try to repair and help heal itself. Because if you have 5 other ailments and you're on 6 other kinds of medication and then you're diagnosed with a cancer, you got a lot going on. You got a lot to overcome. But because I was so healthy, that really, I believe, was an advantage to help me, along with the Western medicine and along with the homeopathic medicines and the acupunctures and all the other things that you add in there. I know you
did acupuncture?
Well, I had neuropathy so bad that, everyone wants to give you a prescription for it, gabapentin or whatever. And I'm like, I'm not with the drugs. I'm not trying to take drugs if I don't have to. Took the chemo, did what I had to do. But when I found that I had neuropathy and it was just nothing, I was begging for medical marijuana because I just figured I might as well just get high and dull the pain or whatever. Right. But, that wasn't the case. I didn't get that. I was introduced to acupuncture. And I had an acupuncturist, Angela Lai, and this girl, I walked in probably a little bit as a skeptic, but it took me maybe 2-3 sessions, and I realized, wait a minute, something is happening here. Something is really happening, and that took care of the neuropathy. But yeah, I am a clean eater. I'm big on nutrition even now. I believe that we have to really start using food as medicine.
Yes.
Because it's not like, a lot of the medications and things that we're getting now are derived from some of the foods and some of the herbs and things like that our ancestors, brought to this country. And now somebody is capitalizing on them and making medicines out of them. But food really is medicine. And we have to lean heavily on eating better, exercising, making sure that your body is moving, and making sure that you're even feeding your mind, with anti-fear thoughts. All of that working in concert together. I'm still that person, and I believe that it has helped me. I remember I had 6 rounds of the most aggressive chemotherapy, 6, and I never got ill. And I remember walking into my doctor's office and they're asking, "Who are you?" And I said, #God's girl. Because I honestly, and I said, did I not feel good at times? Sure, but I never got sick. Like I literally worked the entire time when I was going through chemo, and I was still exercising. I kept my body moving, and I kept looking at the foods that I was eating to help thwart the side effects. I would look at the foods and say, there are certain foods that work to negate certain side effects. So there's so much we can do, to help ourselves. besides always taking a pill to try to, because then you become dependent on that
Yes,
pill.
you do.
You know.
And that's what big pharma often wants. I can't tell you how many times you watching television now. I remember watching television when I was a kid. You saw cereal commercials. You saw advertisement for products.
Yeah.
But it seems as if at every turn, whether you're watching, there is something about a new drug that's out. It's amazing to me to where we are in this society, especially when it comes to medical treatment.
Well, I think if you need that drug, if there's nothing else and you need that drug to help you survive, then it's a part of the science.
It's part of the science.
Yeah.
But that's not void of the things that we can do to advocate for our health by eating correctly.
That's true.
By being, still having that. It's a disservice if you're needing that, but you're still not taking responsibility of the things that you can control.
Yes, that's true. I know people right now that are prescribed a medication that they really need, but they'll say, "I'm not taking that because I don't like the way it makes me feel." And people get to make their own choices, but I'm like, if it makes you feel a certain way, then you need to dig a little deeper into the science to find out, why it's making you feel a certain way. And is there anything you can do to combat that, to mitigate, if you will, so that your body can get what it needs? I'm not, a proponent of just taking drugs arbitrarily. I believe that food is medicine and you could do a lot but sometimes I'd have chemo and my body wasn't going to be able to just take care of the cancer that was inside of me by just eating right. I was already eating right.
Right.
So, I think you have to fall in line with what it is that you need to survive. And then the other things that you can do, that you could introduce to help you, to help you mitigate side effects and to help you be able to tolerate the medication that you're on. But when you say I'm not taking something because I don't like the way it makes me feel, then the alternative is then whatever happens next happens.
Yes, absolutely. Well, I just want to thank you for spending time with us, to sharing your wisdom, to being a voice of a loud voice of advocating, not only for yourself, but for our better health. I want to encourage you to continue to do the work that you're doing. And it's just been a pleasure just sitting down with you.
Thank you so much, Chris. I so enjoyed talking to you. Thank you.
Thank you. Our Queen City community recently lost a brilliant man. T.T. Stern Enzi, artistic director of the OTR International Film Festival, passed away from cancer. He was a champion for underrepresented filmmakers and stories. He was a husband, father, mentor, and contributor to local and national outlets while also teaching journalism. I worked with TT on at least 4 film screenings, and he was a genuine example of humanity. Let us keep our health a priority and remain vigilant in advocating for our health and wellness. I am your scholar and gentleman in a hoodie. Live well and know thy history.